Neurodegenerative diseases are an increasing problem for our society as people age. Right now, however, we're seeing a revolution in how we are approaching these problems. We've already seen the approval of 3 new drugs for the treatment of diseases that affect children and adults. This has all come about by the integrated efforts of many scientists around the world. It's a very, very exciting time in research because we're seeing the power of molecular genetics, biochemistry, and structural biology all coming together to make new kinds of therapies that are going to transform people's lives. The research we are doing here is going to give us the next generation of therapies and diagnostics. We hope we will bring about a day when we will detect diseases before they have even afflicted the brain, much the way that we can detect diabetes or high cholesterol right now, so that people may never even have to experience the consequences of neurodegeneration. In a center like this, we can do things that are not possible in many other institutions. The Center for Alzheimer's and Neurodegenerative Diseases is comprised of about 25,000 square feet of research space. Currently, there are about 80 scientists working within the center, although that number is increasing by the month.
One thing I love about this space is that as soon as you enter, you realize how open and modern and bright it is. It's so much different than any other scientific space I've ever been in. So being all together as diverse faculty under the umbrella of the Center for Alzheimer's and Neurodegenerative Diseases really helps to foster unique ideas that are closely cross-pollinated, I would say. All these diverse fields that used to sit in their own little nooks in the academic world are being brought together to really tackle neurodegeneration in very new and unique ways. That brings forth new innovation, and it's not just innovation for the sake of innovation, it's innovation to target a question in neurodegeneration. That's what I'm most excited about.
We're really interested to understand how proteins change shape to cause disease, and specifically we're interested in a protein that causes Alzheimer's disease, but other diseases as well. The mission of the Center for Alzheimer's and Neurodegenerative Diseases is to work as a collective. So we all work together towards a bigger mission to understand basic science and translate this into translational work. And so we're really working together as one big team, and we hope all of this translates to help understand how these diseases are formed and how to prevent them. But the future in science is very bright, and we're at the forefront of this field.
My work focuses on both the clinical aspect of Alzheimer's disease, such as taking care of patients in the clinic, but also developing research protocols and clinical trials to develop new treatments and better ways to understand the disease that affects a lot of people. One advantage of being at UT Southwestern is being in close proximity to the basic science researchers. And that means that a lot of the discovery that happens at the basic level, such as in animals or cell models, can easily be moved into the human side. These are exciting times for us in the field because there are new treatments that are being made available. And importantly, there are new treatments that could be developed based on our current understanding of how the disease develops and progresses.
We are enormously lucky and grateful to be able to work at UT Southwestern. The philanthropy that supports our work is literally transformational. It allows us to take risks, to jump ahead, to really be bold in our experimental approaches in a way that is simply not possible through standard funding mechanisms. Thank you so much to the Cain Foundation for your support, which enables us to stay at the forefront of scientific and medical discovery.